Good morning. Good morning, my dear students. Today we discuss about the distribution of the drug in the body. This is the another second most important parameter of pharmacokinetics after the absorption and bioavailability. Another is the distribution. When the drug is absorbed and not distributed at the site of action, there will be no therapeutic action. So distribution is the most important parameters after its absorption. So what are the objectives of this distribution? First of all, the overview of the drug distribution. Explain the apparent volume of distribution with clinical importance, implication. Discuss the drug binding to the plasma proteins and tissue with clinical implantation. Explain the redistribution and discuss the blood-brain barrier and the placental barrier where is the drug will be distributed. The drug distribution, that is refers to the reversible transfer of a drug between the blood and the extravascular fluid and the tissue of the body. That means the drug after the absorption, when reached to the blood, then goes to the different tissues and the organs. That is called the drug distribution. And this will be explained very easily by the plasma concentrations versus blood volumes. Here, initially the drug will goes to the plasma concentration, higher concentration, just high concentration in the plasma, then it's distributed throughout the body. So you can see in this graphical representation where the drug will be 1.5, the high concentration of the blood, then it goes lower down at the time beings, because at the time will be passed, all the drug distributed throughout the body. Ultimately the drug concentration will be lost. So in that case, when they reach the site of action is maximum and reach the therapeutic concentration or minimum effective concentration, then you will get the therapeutic activity of the drugs. So plasma concentration versus time, it will be decrease the concentration of the drugs due to distribution. Drug administration. After the drug administration, the drug maybe goes out and the distributed throughout the different part of the body, like vascular compartment, that means blood vessels and the total body water, intestinal fluid compartment, extracellular space, extracellular compartment, body fat, bone, placenta, brain, plasma proteins, liver, and more organs. So different organ, different tissues are accept the blood drug from after the administration of the drugs. So this one can be see very easily the which is part of the then the extracellular fluid, brain, plasma, liver, and what are the factors? Now different factors for affecting the drug distribution. First of all, the lipid solubility and lipophilicity and ionization. This is one of the most important parameters. If the drug is the lipid soluble or lipophilic in nature and it is non-ionized form, the most of the drug are distributed. If it is ionized, the drug distribution will be decreased. Another is the capillary permeability. If the capillary permeability is increases, the drug will be administered very easily. And binding of the drugs of the plasma protein and the tissue. This is the another factors which reduce the drug absorption by binding the drugs in the plasma proteins and tissue like alpha albumin and prealbumin and albumin. Presence of tissue specific transport. Most of the drugs or all the drugs cannot be equally distributed throughout the tissue. Generally, drugs are distributed not equally, it is unequally where there is a specific tissue. Some drugs are specifically like chloroquine, which is maximum distributed in the liver, other drugs dopamine, which is distributed in the brain. So many drugs, different drugs are the different tissues they are, and cardiac output and the local blood flow. This is also another important factor because the drug is basically stored in the blood vessels and the cardiac output is flow rate, control the flow rate and circulation to ultimately, and local flow can be maintain the distribution of the drug because the flow rate is increase the flowability of the drugs. The some another factors we are discussed in the previous, the lipid water partition coefficient of the drug. And that means that suppose the lipid compound and the water compartment, there is a water partition coefficient, lipid water partition coefficient. In that case, if the lower partition coefficient is the higher, the drug will be reached to the distribution in the organ or the tissue. And the pK value, that means if the drug is ionized or ionized form or unionized form. Generally, the lipophilic drug is the unionized form. They are distributed very easily, but ionized drug cannot be distributed very easily. And the degree of plasma protein binding, this case of the, if the plasma protein binding is the high, and higher degree of the plasma protein, drug distribution will be delay or concentration of the drug will be less. The affinity of the drug in the different tissue. In case of different tissue having the different drug affinity, so some drugs are deposited in the some tissues are not equally, and fat like large body mass ratio, that means most of the body mass ratio, that means body weight can affect the drug distribution, and which can vary the age, sex and obesity. Age also, the most of the in the adult age, which is get more, and in case of sex, the male are more, and obesity person, the drug distribution the less. Disease like CSF, congestive heart failure, uremia and cirrhosis can hamper the or alter the drug distribution. Volume of distribution, or basically it is called the apparent volume of distribution of the drug. It is represented by the V, and represent the volume of behavior as a single homogeneous compartment with volume V into the drug gets immediately and uniform distribution, and V is equal to dose of drug administered through IV or parenterally, V, and plasma concentration. So if the drug administered by the intravenous route, and after this plasma concentration it will be calculated, and fluid volume that is required to maintain a certain degree and body and same concentration measure the plasma. Calculate the dividing the dose that ultimately get into the systemic circulation by the plasma concentration at the time C0, or Vd equal to volume of distribution equal to amount of drug in the body divided by C0 and concentration of the 0. So you can calculate the amount of the drug distributed, or volume of the drug can be distributed throughout the body. Next we go through the, suppose you administer through IV 100 mg of drugs and plasma concentration is 50 mg per liter, and the volume of distribution 1000 by 50 equal to 20 liter. This is the volume of apparent volume of distribution, which means if the 500 milligram of reaches the circulation or total drugs, if 1000, if not 1000, if it is 500, then if the plasma concentration is a 0.5 and the Vd equal to 500 by 0.5 equal to 1000 ml. So it is so there means the 1000 ml of liquid of the accumulated in the total 500 milligram of the drug concentration at 0.5 mg per ml at that time it will be the larger than the total blood volume when the drug has been stored in the peripheral tissue, so slower the blood concentration. At that time it is smaller than or equal to the total blood volume, and the drug remain in the vascular compartment. So next, the volume of distribution means the total amount of drug administered through IV and plasma concentration, and volume distribution is when it is slow. VDL is the slow when the plasma concentration is the high, because the total volume divided by the plasma concentration. If the plasma concentration high, the denominator is the high, so the total value will be less. And the same, if the total volume of drug distribution is high when the plasma concentration is low, so the plasma concentration is the low, then the volume of distribution, that means most of the drug are distributed to the body. And distribution into the water compartment of the body, plasma compartment, drug having the high molecular weight, extensively plasma protein binding like heparin, volume of distribution only the 4 liter, whereas the other drug will be the more than the 4 liter. And extracellular fluid, low molecular weight, but the hydrophilic drugs, and aminoglycoside Vd equal to 14 liter. Total body water, low molecular weight and lipophilic, as per example ethanol, Vd equal to 42 liters. So this is the graphical representation of the blood, total blood water, that plasma protein is intestinal volume and intestinal volume 24 liters in case of alcohol, extra volume 14 liter, 10 liter. These are the graphical representation. Plasma protein binding, this is the another most important factor which alter the volume of distribution. If the drug administered after the absorption, then it is goes to the site of action or in the organ or in the tissue. Before it will be bind to the plasma, then the volume of distribution will be less. The most of the drug possessed by the physicochemical affinity of the plasma protein, the acidic drug bind to the plasma albumin and basic drug bind to the pre-acidic glycoprotein, and reversible manner also process occurred and extensively bind to the severe as the circulation of the reservoir. Other protein to which drug can be bind and globulin, transferrin, celluloplasmin, tissue protein and nucleoprotein. So these are the different types of protein can bind with the drugs, and the volume of distribution will be reduced because the drug will be bind with the tissues or other protein. So free concentration of drug in the blood vessel will be less. So protein binding drug is very effective or effect on the volume of distribution. Volume of distribution. Clinical implication of the plasma protein. Highly plasma, what is the clinical importance? The highly plasma protein bound drug does not cross the membrane, so larger restricted to the vascular compartment or small VD. So in that case, the dose will be increases. Temporary storage of the drug which is not available for any action, because action, the therapeutic action will get only the reach the therapeutic concentration of the drug. If the drug will bind to the protein, then the concentration will be the less and ultimately the therapeutic activity will be less. The high degree of protein and binding generally, the drug high degree of protein binding generally makes it the long acting. Plasma concentration of the drug refer to the bound as well as the free drugs. One drug can bind to the many tissue of the albumin molecule conversely more than the drug and bind to the same site. And displacement reaction, drug interaction. Salicylate displace sulfonylurea or methotrexate. Salicylate is analgesic drugs that react displace the sulfonylurea, that means antidiabetic drug, or methotrexate is anti-cancer drugs. Indomethacin, phenytoin displace the warfarin, and sulfonamide, vitamin K displace the bilirubin at the carnitine or neonatal jaundice. In hyperalbuminemia, reduce the binding lead to the high concentration of free drug, as per example phenytoin and the furosemide. Furosemide is the drug of antidiuretic and phenytoin is the anti-epileptic drugs. And other disease like phenytoin and pethidine bind to reduce the uremia. These are the drugs which are bind to the plasma protein, highly bound, and basically highly bound drug to the plasma protein. They are first of all the albumin, basically the drugs barbiturate, benzodiazepine, NSAIDs, valproic acid, phenytoin, penicillin, sulfonamides, tetracycline, and warfarin. And those drugs which are bound to the alpha-1 acidic glycoprotein, beta blockers, bupivacaine, lidocaine, diisopyramide, ipipramide, methadone, prazosin, quinidine, and verapamil. These are the drugs basically highly bind with the alpha 1 or so we can see it. Any the drug if the bind to the either albumin or preglobulin, that is hamper the therapeutic effect of this drug. So in that case the dose will be increases. Clinical implication of the volume of distribution. Dialysis is not a very useful of the drug for the highly is for digoxin and imipramine. It helps the estimation of the total amount of drug at any time. Amount of the drug, volume of distribution into plasma concentration at the certain time. And volume of distribution is important to determine the loading dose or loading dose. VD is desirable concentration. The drug concentration is in the body in the tissue. Some drugs which are specifically bind with the some tissue. Say for example, skeletal muscle, heart muscle, skeletal muscle and heart digoxin emetin bound to the plasma protein, liver chloroquine, tetracycline, emetin and digoxin, kidney digoxin, chloroquine and emetin, thyroid iodine, brain chlorpromazine, acetazolamide and isoniazide, retina chloroquine bound to the nucleoprotein, iris the ephedrine atropine, and in case of bone and teeth, tetracycline, heavy metals bound, and mucopolysaccharides and bisulfate. In case of adipose tissues, thiopentane, ethyl minocycline, and virgin irritate dissolve the neutral fats due to the high solubility and remain stored in the body. Redistribution is another process. Some drugs are redistributed throughout the body, sometimes distributed to the organ, then again the plasma will be release the drugs or protein release that high lipid soluble drugs get initially distributed of the organ, and with the high blood flow brain, heart and kidney enter into the bulk less blood vessel mission, so plasma concentration fell to the drug and the switched out with the tissue. If the site of action there is no and highly perfused organ and the distribution result remain in the drug, generally the greater the solubility, faster the redistribution of the drugs. An anesthetic action of the thiopental sodium injected in the IV is terminated a few minutes due to the redistribution. To overcome, it gives the continuation of infusion. So these are the distribution phase, and another is the elimination phase. After the drug will be administered, just administer the absorption of the drug will be distributed, then it will be after the action will be avoided and it will be eliminated. The extrapolation of the time of the zero given C0, the hyperanalytical concentration, periodical drug and drug distribution achieved instantaneously. Plasma half-life of the drugs, it is the time taken for the plasma concentration or the amount of the drug present in the body reduce 50% of the drug. It is plasma half-life or T-half of the body. What is the T-half? This is very important, localized at the beta elimination phase in the concentration of the T-half of the drugs. The alpha and the distribution, another is the beta is the elimination phase. This is called when the elimination if the when the concentration is reduced just 50%, it is called the T-half, and it is the time required. What is the time? This is called the T-half. Suppose 1 drug is administered 500 milligram. When it is after the administration, when it is reduced its concentration up to 50% and time will be taken, this is called the T-half of this particular concentration. After the one half life, it is 50%. First at the peak concentration 50%, then after one half it is 50%, then after two half it is 25%, then 12.5, then 6.25, then 3. That is the 5 half life. And so after the 4 to 5 half lives, drug will be almost completely eliminated from the body. If you administer the drug before that, there will be accumulation of the body into the body. Blood brain barrier, this is another most important criteria for the where the drug will be distributed. So blood brain barrier this is very important and very congested and tight junction than the any other tissue. In case of basal membrane, lipid soluble drug polar and lipid soluble drug. In case of endothelial cell and urinary capillary, it is the brain capillary. So in this case the drug distribution is very less rather than the any other tissue, because blood brain barrier is a tightly junction than the any other normal tissue. So in that case the drug must be concentration, be careful. Function and the properties of the blood brain barrier: protects the brain from the foreign substances in the blood that may be injured the brain, and protects the brain from the hormones and the neurotransmitter is the rest of the body, maintains a constant environment for the brain. So that's why it is very constricted and tightly bound. Properties of the drug that when we cross the blood brain barrier: basically the low molecular weight substances can be passes the brain, high degree of lipid solubility, non-ionized and tertiary structure, and free drug can be easily passed the blood. Another most important barrier is the placental barrier. The lipoidal and lipophilic substances, para-glycoprotein lipid exposure to the maternally administered drug. Also placenta is the site of metabolism, lower exposure to the drugs, incomplete barrier and congenital abnormalities. Summary overview of the drug distribution, apparent volume of distribution and clinical application. Next, drug bind to the plasma protein and tissue clinical and redistribution and blood-brain barrier and placental cell. Next slide, next video, my children, you can details about the drug distribution in the body in the different state. Thank you. Thank you all. Thank you for listening the lecture. If any question, please write your Google Classroom or in the chat box. And if you like it, please like my channel. Okay. Thank you.